Hearing impairment is one of a range of terms that gets used to describe what could be anything from a partial right through to a total loss of the ability to hear, the ability to detect sounds and make meaning of those sounds. We're particularly fortunate in Australia that we are now at a situation where more than 96% of all children born in Australia will have their hearing screened at or very soon after birth. In most states in Australia, that screen is conducted using something called the auditory brainstem response, which is effectively a signal that's sent from the brain or can be detected from the brain that indicates that an auditory stimulus has been received, that something's been heard. The process of what's called universal newborn hearing screening has been progressively rolled out since 2002, first in New South Wales and then across the rest of the country.
Hi, I'm Sandra, a mother of 3 kids. They're 6, 4.5 and 1.5. My eldest is 6 and he has a moderate to severe sensorineural hearing loss. When Lachlan was born, there weren't any newborn screenings at the particular private hospital that we were at. So we didn't know.
So we now know that about just over 1 out of every 1,000 children born in Australia will have a significant hearing loss at birth. What we also know, though, is that by the time children are of approximate school age, that figure has risen. So there's an important message here that screening children at birth does not guarantee that a child will not acquire a hearing loss at a later time, or that hearing loss may not become evident at a later time. So there are some things that we want to ensure that we continue to look for in the development of children to make sure that we're alert to that possibility of a hearing impairment at a later stage. Very young children, from birth to say 6 months of age, we'd be looking for children to startle when there was a loud sound, or to wake when there were loud sounds around them, turning to a familiar sound source, or increasingly recognising or calming to particular voices, not just any voice. Beyond 9 months of age, we'd start to see, or expect to see, children starting to use what we might call babble, making lots of noises, and noises that increasingly start to sound like speech noises, the bub-bub-bub, the mum-mum-mums that we hear children produce. These are really clear indications of response to sounds that children have heard.
A lot of the time with him, it would be the second or the third time that you said it that he would respond. My other friends' kids were following instructions. So by 18 months, you could say, go and put your nappy in the bin, or bring me the cup, or bring me the blue teddy. All my friends' kids were doing that, and he was not doing it at all.
If for any reason you're not seeing those hallmarks of early listening behaviour, or you're worried about it for whatever reason, then speak to a maternal and child health nurse, speak to your GP, with the aim of having your child's hearing assessed by a qualified audiologist.
We went to Australian Hearing in the city, and I'm like, oh, you know what, this child doesn't have hearing loss. I'm just going because I have to do this in order to get him into speech therapy. And we went there, and the audiologist was behind a glass wall, and they had the puppets, and they trained him with some super loud sounds. So we knew he could hear loud sounds, and when they trained him, once the sound went, to turn, and a little puppet danced. And he was sitting in the room at a little table, with an audiologist opposite him, with some puzzles that keep him interested but not engrossed. And I sat out of his line of vision, and then as the sounds got a little bit softer, not really all that discernibly softer to the adults around, but softer, it was then really very obvious that Lachlan wasn't able to hear. He was very busy playing with his puzzles. These loud sounds just went all around the room, and I was just with tears pouring down my face, just willing him to hear the sounds, but there was no response.
We certainly do get a number of children who come to us with a late diagnosis, or have been diagnosed with a hearing loss a little bit later on in their life, so maybe 3 years and older. Predominantly we get families coming through the SWISH program, which is the statewide infant hearing screening program, but we certainly get some older children who are coming through with a late diagnosis.
In terms of types of hearing loss, there are two main categories of hearing loss. We talk about conductive hearing loss and sensorineural hearing loss. Conductive hearing losses or conductive impairments really relate to anything that stops the travelling of sound from the environment through the ear to the sensory processes of the ear. Sounds will be softer, but typically not distorted. Almost all conductive hearing losses are able to be treated, able to be reversed almost completely, whether that's through something as simple as removing the wax or the foreign body, or a surgical intervention to correct a problem with the ear canal. Or in the most common case of conductive hearing loss with middle ear infections, undertaking the necessary medical interventions to ensure that the infection is cleared up and that problem in conducting sound is removed. The other type of hearing loss relates to the inner ear, which is really the sensory process of hearing, and relates to the sensation of hearing in the inner ear, the cochlea, or the transmission of that beyond the cochlea via the nerves.
They've got these little hairs inside the inner ear, and a little bit like the nerve endings in your skin that tell you when someone's touching you. When these little hairs move, they tell the brain that there's sound. And so either a person can have only a few hairs, or those hairs can be damaged, or that the amount of space that they have, the actual cochlea might be formed a little bit differently, and that can produce a problem at that level. Other people with auditory neuropathy, which is not Lachlan's thing, they can have a problem with the messages as they go along the nerve after the hair cells have fired.
The other aspect of sensory neural hearing loss is that it's not always, but almost always permanent. And a child with sensory neural hearing loss will certainly need the assistance of, almost always, need the assistance of hearing aids or perhaps cochlear implants as a strategy for improving the quality and the volume of sound that they have access to.
In the first instance, families are often really keen to know what the hearing impairment means to their child, what exactly they can hear and what they can hear with their amplification, whether it's a hearing aid or a cochlear implant. And they often want to know what the outcome's going to be, which is really difficult to predict because every child's an individual.